the Evergreen Media Network Studios, brought to you by Evergreen Media, creating cohesive marketing campaigns. Evergreen Media in Vero Beach.
Honestly, without Treasure Coast Community Health, I think we'd be a much poorer community in terms of our health. We're always striving to fill the gap for everyone in the community, rich or poor.
Good afternoon and welcome to Community Conversations. My name is Vicki Soule and I'm the CEO of Treasure Coast Community Health. If you're looking for primary care, whether it's medical, dental, behavioral health, low discounted pharmaceuticals, x-rays, you name it, we're here for you. Just call 257-8224. 257-TCCH, and we'll get you lined up with an appointment. But we come to this radio show every week so that we can have community conversations with others who also offer great services around the community, whether it's in the medical side, behavioral health, or just those things that make us smile inside, whether it is entertainment or other things that are going on around the neighborhood that since so many of us don't take the newspaper anymore and get tired of having the screens in front of our faces, this is the old-fashioned way. So I'm welcoming today Wes Samons from
the Mental Health Collaborative of Indian River County.
That's right.
Yeah.
So the collaborative is truly that. It's an exchange, but it's so much more. Tell us a little bit more about it.
Absolutely. I would love to. So the collaborative originated in 2004. So next year will be our 20-year anniversary of the collaborative.
It's amazing.
There. Right. I know. From what I've heard, it's really the time is flying basically on what we've done since our inception. But yeah, so we basically exist to try to convene the community on different mental health issues and concerns and problem solve and find solutions and gaps that might be there and how to fill those gaps as far as providers go.
And that's been its mission since the beginning. The collaborative was originally not just providers, but people who sort of had a dog in the fight, whether it was law enforcement or funders in the community that wanted to see us become less fragmented in the community. Treasure Coast Community Health has been a part of that for a very long time and have watched all the things grow and develop. And one of the original striking principles was that you would be like a matchmaker. If we didn't offer a particular service, but another place did, you would make sure that those matches happened and people that didn't know where to go could use you as a reference. And I think that has been a sterling point. It's getting harder and harder to make the non-fundraising aspect of it go forward, I think.
Sure, yeah, and that's one of the things that we're trying to kind of tiptoe around these days is trying to help the community without trying to step on the toes of our community partners and those nonprofits that do such amazing work in our community that we've always tried to support and provide with clients through the Connection Center, which we'll talk about. But yeah, so trying to also show our worth in the community and the things that we do and some of the things that we've done behind the scenes in the past, trying to make that maybe be more cognizant for people in the community to see what we actually provide.
Well, you obviously, Brett Hall and you and other leaders within that organization have certainly helped us evolve to continue meeting the needs of the community. And I just want to clarify that while we're a nonprofit at Treasure Coast and the Mental Health Collaborative is a nonprofit, you have as partners many people who are for-profit organizations, and you seem to be very insurance blind to that whole mechanism for our clients, for patients.
Absolutely, yeah, and that is the unique thing about the collaborative and the McCabe Connection Center that is housed inside the collaborative. When someone needs a service, whether it be through private funding or community funding through the hospital district, we're able to kind of keep a database of who has availability based on what your insurance will take care of for you. And so we're able to link people to those different services. And since the McCabe Connection Center started in 2016, we've been able to work with over 90 partners in our community, both public and private. So that kind of shows the different connections and referrals that we're able to make.
So tell us a little bit more about the McCabe Connection Center itself.
Absolutely. So the McCabe Connection Center started in 2016, and it's a community resource, basically. So we have 2 different departments. It would be the clinical side. So if someone is looking for a therapist or a psychiatrist, even case management in some ways, they would reach out to us, tell us what they're looking for, what insurance that they have for themselves, and then we can tell them what's available based on those parameters. So
they don't have to call 15 or 20 different places.
Correct.
Okay.
And we will even go that step further to where that's kind of the last call they have to make on their own. We will go ahead and set up that intake based on what insurance they have, and then that agency will reach out to them. So if we refer someone that has hospital district funding to TCCH, TCCH's intake coordinator would reach out to that person and then set up that.
That's a huge help for people who have anything extraordinary going on in their lives.
Absolutely, and that's what we found, and that's our position is if you're struggling already, we want to take some of those decisions out of your hands, make it easier for you. It can be overwhelming trying to find your own provider. I think we all can attest to that, right? Yeah. Even, trying to find a dentist or anything like that. So calling us and letting us do that for you, I think we have found that that's been a benefit. And since we opened our doors 8 years ago for the Connection Center, we've helped over 7,000 residents in the community to link to resources.
That's huge.
Yeah.
And some of the linkages are not just to the providers of therapy or psychiatric care, medication management, and so forth. But don't you also help in terms of some disability enrollments? Thank
you for saying that. Yes, that's the other side of it. So I said there's 2 parts. Okay. So the first part's the clinical part. The second side is our community/benefits aspect. And so if someone doesn't have insurance and they don't know where to go, they can come to us. We can help them to link up to an insurance provider that can then help them to get resources. Same thing for food stamps, Medicare, SSI. So those are the things that our benefits specialists are trained to do, and then they can link that person to the necessary community resources that they need to kind of take the whole biopsychosocial approach of helping someone in every aspect of their life. So do you still get an occasional call for other social services like housing? So yes, of course. and unfortunately, I like to mention that in the past we've helped with housing, but it's very difficult these days, unfortunately. It is still one of the main calls that we get that's outside the clinical realm is people looking for somewhere to stay. And, but that's not your niche. It's not our niche, unfortunately. And it's not that it's not our niche. It's just that there's just not a lot of opportunities. But I do, our stance is if you call us and we don't have an answer for you, we'll call you back with some kind of option. We'll look into it. We'll see what we can do. And sometimes with housing, those options are limited, unfortunately. Yeah, but there is hope in the future. Here, a lot of activity, planning going on. Yes, and I know you're aware and involved in that, and so am I. And so we're trying to find different ways to tap into different resources. Because we know that whether it's physical or mental health, housing first is really what sets that stability stage for most people. Absolutely, that basic need of having that a roof over your head at night. That's so important to everything else. And it is the struggle. And so I bit my tongue not to say anything when you mentioned life is a struggle already. So talk about the Unstruggle campaign that this group launched. Absolutely. So that's kind of the third aspect of the way I see what the Mental Health Collaborative does, and that's the education piece for the community and helping to break down the stigma of receiving resources. And so prior to my beginning, when Brett was there, they started the Unstruggle campaign, and that's literally just to help people to understand that it's okay to look for resources. You don't have to struggle. Life's a struggle. Let us help you to unstruggle, right? So that's kind of the whole theme around that. And it's more of just a media campaign, and we have ambassadors throughout the community. You're obviously one of them, and we appreciate that, to where we're kind of putting up our stories on our Unstruggle webpage and on our Facebook page to help people to see that we all struggle at some point, and there are ways that we can get around that. And one of those ways is to reach out for resources. And another way that I've seen you reach out is walking. Yeah, so
replacing anxiety with physical activity.
So that was the concept around kind of branching Unstruggle into what we call Unstruggle Step by Step. And so we started a walking club this summer. We realized that starting a walking club in South Florida in the summer is not the best.
Really hot.
Not the best idea.
And humid.
Right, exactly. So we moved into the mall, and it was nice in the mall this summer. But now that we're into the reason why we're all down here, the weather in the winter, we're starting to move it outside again and try to find different locations that are that also showcase Indian River County. So we're going to go to different parks and different scenic areas. So just be aware of that and know that that's coming down the pike. But
are you taking suggestions? If someone wanted to call in or make an offer?
Absolutely, yeah. Anyone that wants to make a suggestion, absolutely, yeah. We've talked to different places. I don't want to put anyone's names out there, but the places that support us and have a beautiful location. So we're hoping to get some things scheduled in the near future.
And again, if they have suggestions about time of day, in addition to locations, we really want to see people show up and do this as a regular kind of activity.
Absolutely,
it's free.
Yeah, it's a yeah. So absolutely, it's a free event, and it's really just to help people to get a little exercise and socialize, right? So the target audience is kind of our seniors that are isolated that don't always get social activity throughout the week. This is an easy way to get a little bit of physical activity and a lot of social activity. And just enjoy the nature of being outside in South Florida in beautiful weather. But yeah, we're open to any kind of suggestion as far as day of week and time. And
so give some contact information if you would.
Absolutely. So the Unstruggle Facebook page is the best place to go. You can go there. You can message us on that webpage. We also have unstruggle.org, which is our website. You can absolutely go there and message us, and the great team here at Evergreen sends those messages directly to us when they receive them. So those are the two main places to go on social media for sure.
Well, shout out to Evergreen Media for helping us with this campaign.
Absolutely.
Couldn't do it without you.
Yeah, they've been tremendous. Yeah.
So we're going to take a short break and then come back and talk about some of the other things that are going on there. Okay, so don't go away. We'll be right back. Treasure Coast Community Health in-house pharmacies have the lowest prices in Indian River County, even lower than big box pharmacies. Taking your medication as prescribed leads to better health. Affordable medicine makes it easier. Treasure Coast Community Health patients can pick up medicine as they leave the office or use free delivery and mail order services. Pharmacists are always available to answer questions. Switch to TCCH pharmacies. Save money, stay healthy. 772-257-8224 and ask about our price match.
Right now at Sunshine Furniture, it's holiday sale time, so you can save up to 50% on selected groups of indoor and outdoor furniture from Lloyd Flanders, Telescope, Windward, Capri, Sea Winds, Universal, and lots more. Sofas, love seats, dining sets, patio groups, occasional chairs, bedroom sets, all on sale just in time to make Santa say ho, ho, ho. Also, all pictures, lamps, and accessories are half off. And don't forget to visit our outlet and sales store just across the street from our main location for lots of great holiday bargains. Sunshine Furniture, 1295 US 1 in the Publix Plaza next to Planet Fitness in Vero Beach. Visit our website at sunshinefurniturecasual.com.
Sunshine Furniture brightens up your day. Sunshine Furniture, the best in every way. Ooh, have a sunshine day. Sunshine Furniture.
Star Quality Airman here. This winter, the evil duo of heat and humidity are in hibernation. But your air conditioning superheroes at Star Quality Air never rest. Get same-day service and flat rate pricing. When you need us, we're there. Star Quality Air.
Celebrate Christmas the old Florida way at Marsh Landing Restaurant. Enjoy traditional dinners with all the trimmings. Make your reservations now and let Marsh Landing do all the work. Marsh Landing in historic downtown Fellsmere. Online at marshlandingrestaurant.com.
And welcome back to Community Conversations. If you're just joining us, my name is Vicki Soule from Treasure Coast Community Health, and every week I bring in guests to talk about different things that are happening in our community, sometimes related to health and a few times not, just to keep it the spice of life. But today I'm talking with Wes Samons from the Mental Health Collaborative, and one of the things that they do, in addition to direct services, matching people up with mental health resources, is that advocacy and education. So one of the projects that is ongoing, although we don't hear a lot about it, is mental health first aid. So for those that aren't familiar with that term, Wes, describe it.
Yeah, absolutely. I'd be more than happy to. So mental health first aid it's for someone who's not clinically trained to deal with someone who might be in a crisis. Okay. So, it may not be something that would benefit someone that's a licensed therapist, but let's say someone that's trained in the business world or works for a community institution like a Publix or a gas station. Mm-hmm. You see someone who might be struggling with a mental health issue. A lot of times people who aren't trained clinically avoid them. They're just afraid they're going to
sort of like CPR on the street. If someone crashes and you're not a physician, your first inclination is to look around and say, there's certainly got to be somebody more capable than me.
Right, exactly. So the inclination for people is to ignore them because they don't want to deal with it, or they're afraid they're going to make the situation worse. Mm-hmm. And so what mental health first aid does is it allows you to identify the problem and also be able to talk to that person and listen to that person non-judgmentally and help them to get the services that they need.
So is there role playing involved in that?
There absolutely is in the training for sure. Just, like being able to...
Because it's so easy to listen to you, right, but actually doing it?
Yeah, so absolutely. So the training is 8 hours. There's a lot of role playing. There's a lot of learning the terminology, learning active listening, the best way to do that and not seem judgmental in the way you're listening, and then also how to use the right words when you're giving advice and not make it sound like you're judging them or that you're putting them down, but you're giving them the confidence and motivation to help themselves.
And that's got to be a real special skill set. When I think about the 8 hours, that seems like a very long time. But the reality is you cover a lot of different mental health issues, diagnosis, or somewhere in between.
Well, absolutely. So, we make sure that the people that go through this training know that they're not being trained to diagnose for sure, but they can identify kind of someone who is going through a diagnosis issue. So if it's someone who has schizophrenia or suffers from schizophrenia, you can notice that they're maybe not in touch with their reality at the moment, or if they're bipolar and they're manic and they're going through that phase, that you can kind of identify that and then know how to talk to them in a way that's going to reach them. So that's a program it's nationwide. It's actually it started in Australia, so it's actually it's all over the world. It's a worldwide program. It's been proven to be effective, and we've trained over 1,300 people in our community.
That's awesome.
Just through through the collaborative itself. So,
and I think it's sort of like that book, Chicken Soup for the Soul. It started as sort of an umbrella. But now there's chicken soup for the teenager, chicken soup for the souls of seniors. Yeah. And some of the mental health first aid is very particular in, part 2 or instead of. No,
you're 100% right. You're spot on with that, with the chicken soup analogy. That's really good. That was good. I hadn't thought about that, but that's spot on. So just to give an example, the school board and then the district, they train their professionals on youth mental health first aid. Okay. So it's how to work with a youth that might be having an issue. And where we're hoping to change the direction of what we're doing and make it more specific is for teen mental health first aid. So that's specifically for teenagers 14 to 18 and how they can talk to their peers. There's so much evidence on peer-based programs these days, and how, I always, as a therapist, I tell parents of teenagers, they're not listening to you anymore. You've done the parenting part, so, that's kind of over. Now they're listening to their peers.
Yeah, that's
and they're listening to their peer
true.
group. Yeah, and that's who gets in touch with them. That's who really gets through to them. So if we can train teens in our community on how to talk to their peers that are in a crisis, I think that will really help with decreasing the issues that we have with mental health for our teenagers.
That's a wonderful idea. As a parent, I'm thinking, which of my children might qualify to be in that position, to be trained as so informal leaders, kids that seem to sort of most of the time have their act together?
Yeah, absolutely. Kids that are,
we're not all together all the time.
No, of course not.
Especially as teenagers.
But I think teenagers that are motivated to help their peers. I think that's the main thing that we're looking for. Definitely leaders, and in some ways, we have leaders that lead in both directions. So we're hoping we're hoping to get on both sides though. If we can help, change the direction that some of the leaders that lead down the wrong path and get to them and reach them to say, hey, this is the need for you to help your friends. I think that would be very beneficial as well.
Well, and they've done that through the DARE groups and some of the other programs that work with the middle school and high school kids to help them understand not just the immediate effect, which is where we go wrong path, but how to then stay on the right path because of consequences. Because, we all know that the teen brain doesn't really mature until they're in their 20s, and sometimes not even then.
Right. Still waiting on mine to mature. Yeah,
well,
absolutely.
That's a guy thing. I wasn't going to go there. But, there are opportunities. And so if a parent or grandparents, the light bulb goes off and says, John would be great at that.
Yeah.
How do they get a hold of you? Is there a cost to it? What type of times are you looking for?
There would be no cost. We are.
Well, that's good.
Yeah, absolutely. No, it would be free for sure. It would all come through a grant that we're waiting to get results from.
Okay.
So hopefully by the end of January we'll know. Right, we'll know the results of that. But then they would just reach out to us at the Mental Health Collaborative, and we would set up the training for their teenagers. It'll be through summer programs. We have 7 partners in the community that are willing to help that do summer programs for teens. So I think most people know who those partners are without giving away that information right now until we have something official. But those partners are out there, and this is an 8-hour training again, so it would be maybe one day of their summer program, or break it up into 2 days for 4 hours, but something that we would like to do for the teenagers in our community.
So as you said, we've got some real stellar people in the community. We've got some that are struggling, and the same applies to teens. So when you first said that about, the teen mental health first aid, I didn't think about them as a peer. I thought of them as being recipients of help. So as a parent, would mental health first aid help with some of the angst of teenage years? Or
absolutely,
not?
Yeah. I would encourage any parent to reach out to us to set up a training for mental health first aid. And all you have to do is call us and ask us when trainings are available. We have trainers that are available and need to do trainings to keep their certification. So we're more than willing to set up multiple trainings a month. Right now, we kind of do one a month, but we're very willing to do multiple ones. Some of the trainers through United Against Poverty are looking to do Saturday trainings as well. So those are something that may be coming down the pipeline. So if you can just reach out to us at that.
And again, they're free.
They're free.
They're free.
These are free trainings. These are trainings that we have received money to set up for people.
My grandmother always said education is never, ever wasted. You might not have an opportunity to use it the next day, but it's never wasted. So if you're interested in learning more about different aspects of caring for others, recognizing, reducing stigma, I would encourage you to call over to the Mental Health Collaborative and sign up for one. And then is there a part 2? Is there a refresher course anticipated?
It's really just a one-part thing. And then, you can always take the course again if you feel like you need a refresher. But it does help.
There's a book that comes with it, right?
There's a book that comes with it. There's a training manual. And one of the, I think the things that would really help parents is it teaches you how to talk to your child about if you fear that they're thinking about hurting themselves. So
very important.
Yeah, it helps you with the right terminology for that. And so especially this time of year, knowing how to approach such a delicate subject is very important.
It sure is. And thank you so much for sharing all of this with us, Wes. Mental health is so important, and we're just in the last couple of years starting to recognize that, but the stigma continues. So we all need help. We all need a little help in getting through the struggles of daily life, whatever life throws at you. So again, thank you for being with us today. all of you that are out there in the listening world, and you especially, Wes. Couldn't have a program without you.
Thank you for having me. I appreciate it, and happy holidays to everyone that's out there.
Likewise, I hope you have a wonderful, wonderful holiday season, and we'll be back next week. Bye-bye now.